Welcome to my vlog. So we're going to attempt to, instead of me writing out, explaining to you about hip stability and mobility, I thought I would try to shoot a video for you. So here goes our shot. Okay, so I wanted to talk to you this week about hip stability and mobility. So important and critical for avoiding hip pain, knee pain, foot pain, back pain, neck pain. Pretty much anything can be attributed to unstable hips. A lot of times when we think about stability and mobility, we think they're complete opposite. However, we need to have both in order to be able to build strength, endurance, and just power ourselves through life. So what I decided is using our hips. So here's my pelvis, and just to give you a real quick anatomy view, we're just going to talk very basic, but you've got your spine, right? So if I were standing, here's my spine. You're looking at me through the front of the pelvis, okay? And then do you see the legs? These are your thigh bones, your femurs, okay? So we've got the ilium, that's these two big bones that to me almost look like elephant ears, and they attach in the back. So now you're looking at a posterior view to the sacrum. They are three separate bones. So I'm kind of spreading them apart. That should never happen to you. But anyway, the sacrum then also attaches to your spine. So just a side note, if you ever hear of somebody say they have herniated discs or they have osteoarthritis or they have something going on with L4, L5, L5, S1, that would be lumbar 4, lumbar 5, sacral 1, and that is where those discs are and where those vertebrae are, okay? And then the sacrum, everything is fused together. But there's a point where the ilium meets the sacrum, and the sacrum's kind of the cornerstone of your body. Your center of gravity sits inside your pelvis. So that's why when I'm teaching melt and Pilates, we talk so much about tucking and tilting the pelvis, being able to hold a neutral spine. So when I say neutral spine, if you were laying down, so let's put the pelvis lying down here. Especially in women, I'm talking to women. Men, your pelvises are a little bit different, and everybody's pelvis is different, of course, but men's are a little bit more different than women's. But this is the top of your hip bone. So if you took your finger and you found your hip bone, this is your anterior superior iliac spine. You have two of them. That you don't have to know that word. I call them headlights, right? So if you think of these two bony spots right here, if you were doing a squat, a lunge, a step up, you'd want these headlights to stay pretty even, pretty stable. And that wouldn't necessarily mean that your pelvis wasn't moving. It would mean that as you were doing a step up, a squat, or a lunge, that your pelvis was not dumping onto your femur, because this is your thigh bone, your femur. And you can see if I pull this away, the head of the femur is nice and round. I almost picture like an ice cream cone, like a nice, perfectly round ice cream cone. And we want to keep that centered inside the joint. And that's something I use the words joint centration, which means that we have this head of the femur centered right in the middle of the socket. So when we think about hip stability and hip mobility, our joint, our femur, our leg needs to have mobility and move inside the joint while we can keep our pelvis pretty stable. So how do we do that? Well, we can keep our pelvis stable from above by engaging our core. And our core is not our abdominal muscles. And that's okay. You still want to work your abdominal muscles, they're muscles, but that's not the end all be all of your core. Your core starts with your breath. The core starts with your diaphragm, and it is all the fascia that is in and around your diaphragm, your organs, your bones, your muscles, and comes through and attaches through to your skin. And in Melt, I teach about your reflexive core, and that carries over into more stability for the rest of your body and the rest of your workouts. Anyway, let's go back to mobility of the femur inside the hip joint, stability of the pelvis and the spine, and that low back space. So remember I said your headlights, right? So the top of your hip bones and the pubic bone, the pubic symphysis, okay, are all on the same plane. So whether you're standing, whether you're squatting, whether you're lying down, those three bony prominences stay in this like triangle, okay? And that maintains a nice little low back curve. And having a little low back space, a concave curve, right? We should have a small curve at the low back because that's where all of our nerves pass through. So now we're looking at the pelvis through the back. All of the nerves pass through here to come through and make you run away from your predators or get the pickleball, chase your grandchild, take your dog on a walk, whatever. But we want to be able to make sure that we can maintain this low back space. So having the core stability to help with the pelvis to keep that stable, while having our legs be able to move inside the hip joint are going to help you get rid of low back pain, tightness in your hamstrings, tightness in your hip flexors. Because when we have tightness in our muscles, it's usually because something's tightening up because another structure or other soft tissues aren't doing their job. So if your body is sensing that, oh my gosh, if my hamstrings don't get really tight, the pelvis is just going to collapse. The hamstrings are going to get tight for a reason, and they might be getting tight because somebody else isn't doing their job. And a lot of times that comes from glute minimus and glute medius, which are right on the side of our hip. Glute max is in the back, and we've got glute minimus and glute medius. And I'm talking about muscles. You don't have to know the names of muscles, and no one muscle moves all by itself. So what we're trying to focus on today, and I want to try to keep this short, is that you're going to work on keeping your pelvis a little more stable. Think of taking a deep breath. As you exhale, can you feel your core? Can you feel, like I say, it's like an internal girdle or an internal vacuum, okay? And then if you were laying on your back, could you take a breath and could you exhale and lift your leg? You could have your knee bent, of course, but could you lift your leg and think of keeping that head of the femur, that ice cream cone, centered in the hip joint without having your pelvis rock and roll all over the place? And that would be my first place to start, and just a short explanation, very basic explanation of hip stability and mobility.